Well, good afternoon. The vast majority of our students will be heading back to the classroom today and over the coming weeks. As a father of 4 daughters, I remember sending them off for the first day of school, and I know that there's a lot of excitement, and I know the kids can be a little nervous. But I also know that it's a good thing our kids are getting back to school where they belong. And we all know that this school year will be different. But by working together, we will keep our children, teachers, and education workers safe. Across the province, there are incredible principals, teachers, EAs, admin staff, custodians, directors of education, medical experts, public health nurses, and many, many others. A whole army of people who have gone above and beyond to make classrooms safe for the return to school. I saw it with my own eyes during the school tour last week. These people are absolute champions. So I want to thank all the principals and teachers and education staff across the province who have stepped up and have done their part. And my friends, we have your backs. We're providing $1.3 billion in supports for schools, 625 more public health nurses, 1,300 more cleaning staff, $246 million to hire more staff, the most rigorous and comprehensive health and safety protocols in the entire country. We have also consulted with some of Ontario's top medical officials every step of the way. I know our entire team has been working around the clock over the last few weeks to get PPE delivered to all the schools. We delivered over, and these are pretty staggering numbers, we've delivered over 37 million pieces of PPE to the school boards across the province. Altogether, they have received 19.5 million masks, 16 million gloves, 317,000 face shields, 320,000 bottles of hand sanitizer, 218,000 bottles of disinfecting spray, and many, many other supplies. We're doing whatever it takes to ensure both our staff and students are safe while they're at school. And I want to say to the parents out there, you've been absolute champions as well, helping your kids with at-home learning these past few months while juggling work. We'll need your help too with the return to school. If your child is sick, please have them stay at home. If someone in your household is sick, considering getting everyone tested. Again, if you're worried you have COVID-19 or you're worried a family member has it, please go get tested and then self-isolate. My friends, the upcoming school year may be different in a lot of ways, but with all of us working together, parents, students, teachers, school boards, and all 14.5 million people in this province, will make it safe and successful. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. As we've said many times since the outset of this global pandemic, nothing is more important than protecting the health and well-being of all Ontarians, including and especially our most vulnerable. Together, we've made remarkable progress in our fight against COVID-19. We have successfully avoided the worst seen in other parts of the world. This progress has only been possible because Ontarians have demonstrated incredible resolve. You've worked incredibly hard to limit the spread of COVID-19. But as much as these efforts have made an impact and enabled us as a province to move into stage 3 of reopening, the latest trends in numbers have raised some concern, especially as we begin to reopen schools and post-secondary institutions. That is why, based on the advice from the Chief Medical Officer of Health and the Public Health Measures Table, we will be taking a pause of 4 weeks, or two-week cycles of the virus, before considering any further loosening of public health measures or further reopening of businesses, facilities, and organizations. We did not make this decision lightly. Ontario's business leaders have shown incredible ingenuity and innovation in keeping our public safe. However, we do need to ensure that the progress we've made is not lost. Taking a pause in further reopening at this time will help us to avoid returning to broad-scale closures and shutdowns. And on this, the first day of school for many young Ontarians across the province, we need to do everything we can to limit the spread of COVID-19. The best way to keep our schools safe is to keep our communities safe. So we are once again asking all Ontarians to please follow public health advice. Continue to practice physical distancing, wear face coverings, practice good hand hygiene, stay within and protect your social circles, and quarantine when returning from outside of Ontario. These everyday actions are as essential today as when our province first entered this fight. They will help keep you and your friends, neighbors, and family members safe so that we can, in the future, continue to safely enjoy the loosening of restrictions. Thank you, and now I'll invite up to the podium Minister Lecce.
Good afternoon. There is nothing more important than the safety of our kids. I was able to again see firsthand what focus on safety really means earlier this morning while I was visiting students at Monseigneur de Chabanel in Toronto. It is clear that our province is ready and we are prepared. Our plan, supported by the Chief Medical Officer of Health, introduces multiple layers of prevention. It prioritizes infection prevention by implementing a bundle or suite of actions to limit the spread. Our plan is comprehensive. It is nation-leading, fully funded and evidence-informed, and endorsed by Ontario's top doctor. In Ontario, we are the only province to mandate masks in schools, in classrooms most specifically. The only province to build up our testing capacity, focusing on asymptomatic students. We're the only province to have more than doubled public health nurses within our schools. That's more than twice the number of medical practitioners working with educators and for our kids. We've dramatically improved the expectation on cleaning, hiring, as the Premier noted, over 1,300 cleaning staff to keep our contact points, our surfaces, restrooms, and classrooms clean. We've dramatically stepped up investments to ensure we have clean buses. We've provided free PPE to all students and to all staff. We've mandated strict assessment of all students and staff before they enter those schools. And we have the money set aside to respond to the flu season just around the corner. We must remain mission critical, focused on what truly matters to a civil society, that is our children, the next generation, that they continue to learn within schools. Our decision to pause further reopening or loosening further public health measures, as Minister Elliott noted, underscores our clear commitment to our children. This is what matters. And when we see COVID-19 cases rising, we will not hesitate to act. We will put your kids first. One thing that at times is being overlooked, perhaps, while we focus on the physical health, is the importance of positive mental health and access to care for our kids. Many face anxiety and social isolation over this pandemic. And this is personal for me, I know for Minister Elliott and the Premier and so many others. We've seen the impacts on family and friends on mental health. So let's be there for each other. Let's be kind and be positive. And to be understanding given this very challenging reality that's been imposed on all of us, our educators, our parents, the students, and our health practitioners. But most importantly, let's be there for those in need. You know, we stepped up our investment, over $30 million in more funding to hire more mental health workers, and that's going to make a difference. As students begin to get back to class, I want to thank them for inspiring their province. I want to express gratitude to our frontline workers, our teachers and principals and administrators for committing themselves to the safety of our kids. And thanks to Ontario's moms and dads for their sacrifice along the way. We are truly in this together, facing that invisible threat. But our collective resolve and our continued actions will ensure we succeed, to ensure our kids learn and that our schools are safe. Thank you.
You'll go to the phone line for questions. First question.
I just want to give a quick shout out. Folks, I was coming down to Queen's Park. I do my typical stop at a Timmy's to get a coffee or a tea. And I saw two great firefighters. And I'll tell you, I love these firefighters. I say how much I love the police, which I do, and the EMS, the paramedics. But I talked to two great guys, Roman and Carlo from West Command. And I just want to thank all the firefighters across the province. You guys are absolute champions. Keep up the great work. And I just love our first responders. Because when we're all in trouble, who do we call first? 911. and they come in like the cavalry, all of them. So keep up the great work, guys, and we'll always have your backs. So thank you for that.
Okay, we'll go to first question, please.
Your first question comes from Travis Danraj with Global News. Please go ahead.
Hi, Travis.
Hi there, guys. Thanks for taking my questions today. My first question is for Minister Lecce. Minister, at your old alma mater, St. Michael's College School, sanitizing foggers are being used with hospital-grade disinfectant. Thermal cameras are located throughout the school that can take 1,000 temperatures in 90 seconds, and if a student has a temperature above a set limit, a photo is immediately sent to administration. Every teacher will also receive ultraviolet lights for sterilizing their desks and tablets. These are all procedures not in place at public schools, as you know. Do you think socioeconomics should be a factor when it comes to student safety in Ontario? And if not, why is it?
We believe that every student within publicly funded schools and likewise in independent schools, every single young person should be afforded a very high standard of safety. And our plan is, I really do believe, is comprehensive, including all those layers of prevention. The fact that, as the Premier noted, north of 31.7 million pieces of PPE, hand sanitizer, cleaning products, as well as masks have been sent into our schools, I think only underscores that we will not rest until every single publicly funded school in this province has every layer of prevention in place. And I think what is unique for our publicly funded schools is we will have public health nurses twice the number there were just last year, supporting our educators and helping our kids get through the next few weeks and really the next year. And we're going to have a variety of other added values that public education can have. That includes testing within schools when the local public health officer wants or asks for that direction. And so we will continue to put the monies aside. To be quite frank, when it comes to the economics of this, over $100 million we just unveiled a few weeks ago for school boards to use for any type of emergency purpose, including for custodians. And we are hiring literally hundreds of custodians. Each and every week we're seeing more of them come online, cleaning staff, to make sure that these schools are safe and likewise our buses are safe. And that $1.3 billion investment is going to make a major difference. It's what positions Ontario to be a leader in that respect. We know how important it is to keep our classrooms, our playgrounds, and our buses safe, which is why we have significantly invested to ensure that they are constantly cleaned. The constant contact places are cleaned as well throughout the day.
Follow-up?
The core of the question was, do socioeconomics play a factor when it comes to student safety? But my second question is, this weekend a parent who is also a teacher interrupted your news conference saying that his son's JK class has 27 students. Now in June you said class sizes would be capped at 15. That decision obviously has changed. Why did it change, and did you mislead parents with that statement, which is on video?
What we said back in June was based on a health protocol that was responsive to the risk, that of course was much different than it is today, because as Minister Elliott noted, the people of this province have helped sacrifice and worked hard to help reduce the risk and flatten the curve. Obviously, the risk assessment has changed, and we have ensured that our plan is nimble enough, supported by the medical community and of course informed by science, to respond to that risk. And so that's why we have built in additional layers that I didn't announce in June, new investments we've announced. We've more than doubled funding since then, as a way to underscore to parents that we'll do whatever it takes. In the context of socioeconomics, what I can just simply add to that point, to the earlier question, Travis, is that school boards, supported by the Ministry of Education, are putting more resources, what we're called intensively staffed resources, into those communities that have higher risk, sometimes that may come from more challenged social economic communities, and there sometimes can be causation between the two. The point is, we are reducing classroom sizes. The school boards are doing that, putting more funding in place, reducing the amount of kids there, and ensuring more cleaning is being done in those very communities with higher risk that often historically come from areas that may have lower socioeconomic demographics. And so we just want to make sure that no matter where you are in the City of Toronto, you're safe, and that's why we're taking that triaged approach of focusing in on the highest risk communities.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Cynthia.
Hi there, Premier. This question is for you. I know that you're putting a pause for the next few weeks on any further reopenings. I'm assuming that means expanding social bubbles, for example. But in looking at the numbers, they are really creeping up. On the 1st of September, the average was 107 cases in a 5-day period. Now we're up to 170. Do you think that people should start going out less? Is there a point where you will perhaps close indoor dining at restaurants, indoor bars, to try and quell this? Because it's only September 8th, and it seems things are going to get worse before they get better.
Well, thanks for the question, and I always refer over to the Chief Medical Officer and the health team when it comes to those decisions and consultation with other medical professionals. But let me put this into perspective. First of all, there's 18 regions that have no cases. There's 3 regions that are concerning to me. Brampton is very concerning. Ottawa is very concerning. Toronto, mind you, there's close to 3 million people, but if you add all of those cases up, they're the vast majority of cases in the province. And I got to beg the people out there. I've heard cases. We were on a health meeting yesterday, quite an extensive one, and I'll let Dr. Williams elaborate on it. But we have a camp up in Muskoka. There's over 170 people, and it was just by fluke the OPP came there because I guess someone must have called, being irresponsible, having international visitors, and sure enough, there was a COVID case. And then there's some big parties happening in Brampton. I don't want to paint a broad brush from Brampton. I love the people up in Brampton, but there's small percentage of people, and I've heard it firsthand, and in my own community in North Rexdale, that we can't have these parties. Like, I have a friend that lives down the street telling me they were going until 3 o'clock in the morning. And then the system, in my opinion, is broken when the OPP have 622 charges, and then it has to go up on the federal quarantine. And I mentioned this to the Deputy Prime Minister yesterday in our conversation. 2 people out of 622. It goes up to the RCMP, then it goes to a quarantine officer, then they decide if the people are going to be charged or not. We have to come down hard on people that aren't quarantining coming into our country. It's a privilege to come into Canada. It's a privilege to be here in Ontario. And if you aren't quarantining, if you aren't sitting on your couch, we're coming after you. It's very simple, because it is concerning that we see the numbers going up. But keep in mind that there's in my opinion, 3 hot areas: Ottawa, Toronto, and Brampton. And I can't emphasize it enough that we can't have these big parties. We can't have the big weddings. I understand a lot of cultures have massive weddings. They're bringing families from all over the world. You just can't do it. Simple, postpone your wedding, get married in a small group, but you can't have these big gatherings. It's frustrating because it affects the rest of the province when everyone's doing so well in small groups within communities in Ottawa, Toronto, and Brampton. It's the vast majority of the cases, so it's very concerning. I want to pass this over to Dr. Williams, if you don't mind.
Yes, well, thank you, Premier, and I would echo the comments and concerns that the Premier has raised. And one of the aspects of when we're starting to see this number creep up again, and we see them as part of large communal gatherings, it's obvious that whether people think the excuse of COVID fatigue or whatever, that they can go lax and lay aside the public health measures. This is not the time to do it. We're heading into the fall season. We're heading into respiratory virus season. And on top of that, we're trying to open our schools and that. And as the Minister Lecce had said and the Minister Elliott, it's the community side we've got to look after and keep that number down. This is not the time to get casual about that. And we hear people saying, well, I thought it was no big deal. And you can see it is a big deal. And we've been asking people that are going to school and some are coming in already infected. They got it outside the school. And we're saying, one, if you're symptomatic, don't go. If you're sick, don't go. The other aspect is that if you've been in a large communal gathering where you don't know the people, That's where we had our social circles. And if you do not know the people and their exposure, you can't assume that it's not a problem. It is probably a problem. And you're going to have to be more and more careful in the next number of weeks, especially as we go into this time. You've heard the predictions about second waves, and you see that other countries are experiencing that at this time. It's not just talk, it can actually happen. And if everybody starts to slide, then you end up with a second wave. And whether the Premier is saying whether people coming from outside bringing it in, or you're sitting in groups and gatherings where people have brought and come in without proper protection, you know you're putting yourself, your children, and then your school at risk. And so we're asking you to really hold the line at the moment for the next 3 to 4 weeks especially. We got to be really stringent on those adherences, and we got to really make sure I'm not putting myself at risk, I'm not putting my family at risk, I'm not putting my children at risk, and then my children in the cohorts that are going to be involved in the school setting, whether I'm teaching there, working there, or a student going there. We really have to tighten and be firm on this at this time and not loosen up and be casual. So I would echo the Premier's comments exactly.
Follow up?
Thank you. Premier Ford, my follow-up is for you. If you're so concerned about these 3 areas, Brampton, Toronto, Ottawa, would you consider pushing them back into stage 2? At what point would you do that?
Well, again, I would consult with Dr. Williams and his entire team. We aren't there yet, but if it just keeps creeping and people are ignoring the guidelines and the protocols, come on, guys, we have gone through everything together as a team. And you can't let your guard down now. And it's a small percentage, Cynthia, but we just can't do it. I talked to a few people over the weekend, and one person told me a story today that their daughter's at university and called up and said, "Hey, Dad, there's a big party. My roommates are going to a big party, and I don't want to go, but my roommates are going." Guys, I always brag, we have the brightest students anywhere in the world in university and college. Prove it. Don't go to these big parties. I understand Queens had to close down the pier over there. Guys, you're the best and the brightest in the world, in my opinion. Show it. No more parties. I just can't stress it enough. I don't want to sound like, some dad lecturing you. I'm just talking to you as a friend, as a premier. Don't go to these parties, because what affects these school numbers with the cases of COVID is going to be community spread. I'll guarantee, I know that's the case, that the higher the community spread is and the higher the numbers in the community, it's going to affect the schools. It just goes hand in hand. So, yeah, am I a little frustrated, Cynthia? Yeah, I am, because it's pretty simple. Just follow the guidelines. Don't have these big parties. Don't have these big family gatherings. It is simple. And I encourage the neighbors, if you hear the big parties, call. I know it usually happens at 12, 1 o'clock in the morning. Call the police. And I'm asking the police, go in there and lay charges. Very, very simple. We have to start putting the hammer down on people that don't want to follow protocols and guidelines, because it's going to affect every single one of us. And as I told my pal on the phone today, I said, the young people, they're resilient. Of course, they're resilient. They think no problem. But how about old guys like me or the grandfathers or grandmothers that it gets spread? Think. Sorry about that, Cynthia, but I got to get it through to everyone one way or another.
Okay. Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Good afternoon, Premier. This is a question for you or Dr. Williams as well, I'd like to hear from. When schools were shut down on March 13th, there were 155 new cases reported that day. Today, as some schools reopen, it's 185 cases, and it doesn't sound like it's at the stage where you're saying you want to close them. So I'm wondering what metrics are being looked at. Is it community spread? Is it that it's so regional? Are you looking at hospitalizations? Why close in March and open now when the numbers are actually higher?
Well, good question, Brian. I will pass it over to Dr. Williams, but before I do, there's so much we have learned, the world has learned, the medical professionals have learned, we've learned, all of us, from March the 13th to now. It's staggering, and we're going to continue to learn more about this virus, but I'll pass this over to Dr. Williams. Thank you.
Yes, and thank you, Brian, for the question. And if we look back and compare, when we were starting in early March, we were dealing with numbers like 20, 40 cases a day. We were only doing about less than 10,000 tests a day. Our percent positivity was then well over 4 to 5%. So we were looking at that. We saw the in-migration of everybody coming back from March break. We became aware that, in fact, even though we were told originally there was no evidence of infection on the eastern seaboard, there actually was undetected. And so there's a great concern about the amount of spread. Our numbers rapidly moved, as you noted, the number you said. We were going up by over 100%, almost like every 3 to 4 days, from 20 to 60 to 150. And then the week after, you noted there, we were up to around 350, and we were right up to 600 fairly soon after that. So we were on a rapid curve, spike going up. And so in the projections and that, we could see things were moving and evolving fast, and we had to decrease the amount of transmission that was occurring. And the decision was, or my recommendation, to close schools at that time because we didn't know what people coming back from the March break were actually bringing back into the schools at that time. We're in different times now, and yet there's still reasons for concern. What we have now is we don't have the widespread throughout the whole province, as the Premier said and the Minister said. We have some areas with no cases for many weeks, some with less than 5 cases for almost 2 months. So we don't have a widespread influx into the whole province. Yet, we do have people coming in, some not following the quarantine rules, some having family and group gatherings in areas. So we haven't got widespread through all of Peel. It's concentrated in certain areas. We still feel we're containing it in those community-type gatherings, saying that should not have occurred, notifying everybody and saying, with the public health officials, you have to be going to quarantine, you have to get tested, et cetera, and not go in the schools. We still have containment at hand, yet we see the behavior in certain groups and gathering being less than quality and going out and allowing greater spread in those areas, in those aspects there. So we're in a different part of the epi curve than we were back in March. If we see we're starting to rise rapidly again, when you talk about the second wave, you see your numbers from your baseline start to go up by 300 to 400%, then we're going to have to make a step at that time. We're not seeing that, as the Minister said and the Premier said, we're seeing a percent increase. That doesn't mean we can be casual about it. We take it seriously. And how do we bend that back down again to make sure we don't start on the rise of a second wave? So, different times.
Follow up?
Premier, you'll be meeting with Quebec Premier François Legault later today.
Yes.
And part of it is to talk about getting the economy going. I'm wondering if you've had many discussions with the federal government and Deputy Prime Minister Freeland, because the indications are that they might be looking to go in a very different direction than you would. Talk of a universal basic income, something that you canceled, discussions of building back better, but that meaning a massive federal incursion into social programs, which is generally provincial jurisdiction. I'm wondering if you've had discussions, if you have any concerns about what you're hearing, and if you'd be willing to tell the federal government no if they delve too deep into provincial jurisdiction.
Well, I think we've been pretty clear. We're pretty passionate, all the premiers, about the federal government jumping into the provincial jurisdiction, and they understand that. And we'll sit down and have a great discussion tonight, both myself and Premier Legault, and then we're going to have, I think there's 5 cabinet ministers coming in from Quebec, and our 5 cabinet ministers, but there's a wide range of different items we'll be discussing, including the economy, getting that moving. But I've always said right from the beginning, and I mentioned this to the Prime Minister, Deputy Prime Minister, like I said, I had a good conversation yesterday and very frequently with the Deputy Prime Minister. Let's focus on the things we can agree on. There's going to be a lot of things we can't agree on. It's very simple. It doesn't have to be personal. It doesn't have to be attacking each other. We just aren't going to agree on it. And that's fine. But there's so many other things we can agree on that we can work collectively together and be collaborative with each other. And I think that outweighs the negatives. So we're going to have a great discussion. If you add up our population in Quebec, we're well over 60-some-odd% of the overall population, and we have a loud voice when it comes to dealing with the federal government. But I've always mentioned on the Premier's call that it doesn't matter if Ontario is the largest province. I will always stand up for the smaller provinces and the territories. It's critical. I say it on every single call. What is good for Ontario and maybe Quebec, large provinces, may not necessarily always be good for the territories. Each territory has about 30,000 people. And other smaller regions, the provinces, but I'll always have their backs. I'll always stand up for them. And we'll work together, in which we have. We have a really good group, and Premier Francois Legault will be the chair of COF moving forward. And I want to say thank you, my good buddy Scott Moe, Premier Moe in Saskatchewan. He's a champion. Man, he's done an incredible job for the last year, so thank you, Scott.
Last question.
Your final question comes from Caroline Alfonso with the Globe and Mail. Please go ahead.
Hi, Caroline.
Hi, thank you for taking my question. My first question is for Minister Elliott and perhaps Minister Lecce as well. Minister Elliott, can you be more specific as to what you're putting a pause on and why schools are not included in that pause when educators have been saying that distancing is not possible in the classroom?
Well, we're really concentrating on getting all of our students back to school safely and having them remain healthy. But the reality is that spread in the community will also likely mean spread in the schools. So we need to limit the spread in the community as much as possible. And that's why we're not proceeding with any further extension of any measures, including any greater size of our social circles, any greater increases in number of people being able to go to sports events and those sorts of things, because we want to keep the community transmission very low so that it won't get into our schools, so our children will be safe. That is our absolute top priority for right now, and what we need to focus on, because that's the issue that's worrying most parents and families.
Follow-up?
My follow-up question is for Minister Lecce. My question has to do with the academic outcomes of children, of students. I'm just wondering why your government hasn't made any changes to the curriculum to address the gaps from the spring as students begin the year, or what is being done to address the learning gaps as students return to the classroom.
Yeah, thank you for the question. First off, our province has funded a $10 million training of all educators for health and safety. Focus on mental health is important for the resilience of these young kids as they come back, and ensuring that their mental health supports are well in place when and if they need them. With respect to curriculum, our educators are working hard for the first few days, focused on health and safety protocols, really normalizing that and from a behavioral perspective of our young people, make sure they understand the protocol, understand what to do, where to turn to if they have a question, how to properly manage a mask and handle a mask, how to wash your hands thoroughly. All those fundamentals will be done. In addition, refresher learning will commence for the first period of time to bridge that gap between last year and this year. Our educators know, and relying on their judgment and their expertise, how to really do that best and utilize the curriculum to get young people back on track when it comes to their learning. Obviously, we continue to make that a priority. It's why, even in the context of online learning, which some of the high school students in those higher risk communities are doing a blended model, some parents have opted for that 100%, no matter where you land on this. We have made clear from a pedagogical perspective, from an educational perspective, we expect that learning quality will be strong, and it's going to be live, and it's going to be improved for the students and really for their entire for their classroom. And that's why we've set a 75% standard of live sort of Zoom-like learning. That's important to the government. We want those kids to succeed as well. And so we're going to continue to work closely with frontline teachers to see if any further adaptations need to be made to make this a positive learning experience and a safe one for the people of Ontario.
Thank you, everyone.
Thank you.
Thank you, everyone.